Hi and welcome. Um, I'm very excited to be introducing these new online lectures, which I hope you'll find useful. A bit of background about me. My name's Ahmed Adlan, and I'm a cardiology registrar based in West Midlands, UK. I trained in London and worked there for a number of years, and then moved to Birmingham, where I am currently. Throughout that time, I've had quite a lot of teaching experience, and I've seen, good teachers. I've seen great teachers. I've seen really bad, um, and I've tried to take the good aspects and try to avoid the bad. So you could always say that teaching has been a sort of personal interest of mine. You may ask, why cardiology? Well, firstly, this is my area of expertise, training as a cardiologist. Um, the other thing is, cardiology is a specialty that many people are not very confident about. They often bury their head in the sand when it comes to dealing with cardiology related problems. And I've been there myself, not been very confident, and dealing with difficult cases, and I've seen many colleagues, medical students, and junior doctors sharing the same sort of struggles. So I thought, why not set up lecture series to try to improve people's understanding of cardiology. So it is a very common um, area. There's so many people within the hospital setting who develop cardiology-related problems. It doesn't matter whether you're in the medical field or whether you're in the surgical field. You may get, patients with atrial fibrillation pre-op. They're on warfarin or anticoagulant. What do you do about that? It's very difficult, really, to get away from um, dealing with, cardiology-related problems, and it is a very rapidly evolving field, and sometimes it is quite hard to keep abreast of all the latest developments. So because of that, it can often be very confusing. So my aim really is to try to provide some lectures, very in a clear and concise manner, within a format that's quite convenient. You can watch these videos at your own pace. You can rewind, watch them again if you didn't understand something. I've always tried to keep things, very simple. I think often the best teachers that I've seen, they've made things look very simple, and they've explained things in such a way that I can understand. And yeah, my aim is to try to improve your understanding and your confidence in dealing with patients with cardiology related problems. Obviously, an extra bonus is that it's completely free. I'm not charging anything for people to watch these videos, so you know um, but I've got there is a few disclaimers that I've got to mention. So, first thing is, like I said before, medical knowledge is always evolving, and there's always uh, new developments. So sometimes you may find that something that I may say may be out of date. I will try my best to keep things as up to date as possible. But just keep an eye out on the date of the videos, just in case uh, not all the information will be up to date. Second thing, I recommend people to refer to your local policies and guidelines. What's done in your own hospitals, really. Um, Sometimes certain services are not available in certain places. In certain hospitals, certain drugs and are avoided, or they're not available or as freely available. So try to find out what's what your local policies are, and that's particularly relevant with things to do with troponin, because every assay you'll find is very different. Um, and then the last thing is, that medicine really should be practiced under supervision. So, you always find someone who's more senior than you that you can discuss cases. Don't feel that you just listen to what I say and then just go out and just do whatever you want. You should, practice medicine under supervision so that you can learn from your experiences. So, it is a great pleasure that I invite you to enjoy these talks, learn from them. If you like them, share them, subscribe to the channel, and keep in touch as I update with new videos. If you have any feedback, absolutely welcome, 100%, positive or negative. Just send me private messages, and I'll do my best to get back in touch with you. All right, thank you very much.